I looked at the option this provided for us as a state. And if this was my business, I wouldn't just say no. I would say, what we're talking about here is good for our state. So let's see if we can find a third way. And that's what we're proposing, is a way that takes advantage of the federal funds, but buys people into private insurance, and then leverages that to work with our providers to provide lower cost health care for Tennesseans. We've had very specific conversations. So for our plan, the Tennessee plan to work, we had to have the cooperation from the providers, which quite frankly they've done more than we had. They've been great at being responsive. The federal government, which is Health and Human Services, has lacked clarity. I think it's the best way to put it. They haven't been very definitive about what they would or would not do, and we've been clear to them. We're working on a timeline here. We have to have a budget amendment in the next week. If we're going to accept the funds, it has to be in the budget amendment, and so that's why I thought the best thing to do was to come tell the General Assembly today exactly where we are. There is no more important issue or more complex issue facing the state today than health care. The first is cost. Regardless of what we decide to do in covering any additional people, the Affordable Care Act will cost the state of Tennessee almost $2 million additionally over the next 8 years. We'd be really clear. That's regardless of whether we decide to cover any new enrollees. That will cost us almost $2 million over the next 8 years. Secondly, and maybe even more importantly, it doesn't address the real issues of health care reform. Users and payers not being aligned, and providers and payers not being